Welcome to the Rios Center for Plastic Surgery. By this time you've probably met my amazing staff and nurses, and they've helped you get to the pre-operative room. In a few minutes I'll be coming in to talk to you about your procedure, but today I wanted to go over what you can expect today, tonight, and during your recovery period. A few minutes after I talk to you, you're going to meet Chris, who's going to give you the anesthesia. And after that, he's going to answer your questions, and then we're going to give you general anesthesia. And so what that means is we're going to put a little medicine in your IV, and you'll become very relaxed, and you probably won't remember anything after that. We'll escort your loved ones to the front, and they're welcome to stay during the procedure, or they can run errands and we can bring them back. We'll be taking care of you during the procedure. Now, the procedure may take several hours, depending on how much we're going to do. Afterwards, you're going to be in the recovery room with one of my nurses. And after a few hours, when you wake up a little bit more, we're going to get your clothes on, and we'll get your loved one back to the recovery room so we can go over some more instructions with them. Now, when you wake up, you're already going to have a garment on, a compression garment, which keeps the swelling down and secures our surgery. You're going to go home with that garment, and you're going to wear that garment for the next 6 weeks. You can take it off to take a shower. If you're going to be outside at a baseball game or somewhere hot, you can take it off for a few hours, but you don't want to leave it off for a day or two, because then it may be hard to get it back on. It's really going to keep the swelling in check for the first few weeks after the surgery. So we're going to put you in a garment today, and then you can change the garment to a new garment tomorrow. We'll be giving you 2 garments to go home with. Now, when you go home, you're going to sleep a lot, and you can sleep on your back or you can sleep on your side. However, I do want you to get up and start moving around. So when you need to go to the bathroom the first few hours after surgery, I want you to tell your loved one to walk you around your bedroom, maybe to the kitchen and living room, and then walk you back to the bedroom. Eventually, I want you up in a chair and watching TV, and then the next day or two after surgery, I want you to have a goal of getting out of bed and walking around every hour for 2 to 3 minutes. That'll be good for you. It'll help you recuperate, and it'll prevent pneumonias or blood clots in your legs. Okay? Now, the first night you go home, we're going to send you home with some blue pads. But I want you to put the blue pads down, and I want you to put some towels down on your bed, because we usually see a little drainage, a little leakage after liposuction surgery. And the leakage can have a little bit of clear liquid, and it can have a red tinge to it. It doesn't mean you're bleeding, it's just some of the fluid that we put into the space that we do liposuction leaks out. Usually it only leaks overnight, and then it usually stops by the next day. So the next day when you take a shower, you can take that garment off and throw it into the washer, and you can replace the new garment after you take the shower. Now again, you can take a shower the next day. The incisions that we use for liposuction are very small and very few, and so we're just going to put band-aids on the incisions. And when I come and talk to you and mark you, I'll show you where your incisions are going to be, and so your loved one can help you change the band-aids tomorrow after your shower. Again, there won't be any drainage or leakage after the first 24 hours. Now, with liposuction, we can expect a little bit of bruising, but with the technology that we have, we usually see it gone in the first 1 or 2 weeks. We usually don't see deep purple bruising like we used to in the old days. So I would expect 2 to 3 weeks the bruising should be gone. Now, you will have some numbness over the areas that we do liposuction. Now, the numbness doesn't hurt, it doesn't burn, but you'll notice that you don't have as much sensation in the area we do liposuction versus the areas we don't do liposuction. It takes a few months, not a few days or a few weeks, but a few months for the sensation to come back. Now, I warn all my liposuction patients not to get on the scale the first week, because you're going to gain weight. One of the reactions to surgery is that your body is going to hold on to as much fluid as it can over the first few weeks. So you will actually gain weight the first 2 weeks after surgery. And so some people get very disappointed because they thought they were going to lose weight. But what will happen in about 2 weeks, your body will start getting rid of that water and your weight should go down. Also, if you try to put on your tight clothes in the first week or two, you may not be able to put on the tightest clothes that you have. Just give it some time and the swelling will go down. Again, like I said, you can take a shower the day after surgery and just replace the Band-Aids. There's no real special diet after liposuction. You can eat whatever you want once you get your appetite, but I want you to really concentrate on drinking a lot of fluids, Gatorade, some fluids with sugar for the first few hours so you can replenish yourself. Because remember, during liposuction, we're taking fat and fluid out of you. We're also replacing with IV fluids, but you need to keep replacing fluids while you're at home. That makes it a lot safer for you at home. Exercise can start in about 3 weeks. And driving can start in a few days if you think that you're able to drive without too much discomfort. I hope that you've had a good time here at the Rios Center for Plastic Surgery. I hope these instructions will be very useful for you. You're going to see me in a few minutes, and I'll be happy to answer any other questions you have at that time. Until then, I'll see you in a few minutes, and you'll also be able to meet Chris, who's going to give you the anesthesia after I talk to you. Thank you very much. Not only are you going to be having liposuction today, but you're also going to be having a fat transfer to your buttocks. So I wanted to go over a few specific instructions for the fat transfer. I told you all the instructions for liposuction. Now with the fat transfer, the main thing is that we don't want you sitting or laying on your buttocks for the first 2 weeks after the surgery. So when you're sleeping, you're either going to sleep on your tummy or you're going to sleep on your side. You can get up and sit when you go to the bathroom, but just sit down, do your business, and then get off your buttocks as quickly as possible. You could sit for short periods to eat food, but I don't want you to be sitting in a car driving to Houston or San Antonio. You really need to be mindful of this. And after 2 weeks, you can go ahead and sit normally. Now, what's interesting is that many of my patients who undergo this procedure don't seem to complain about this very much. It seems that the time goes pretty quickly. It's only 2 weeks, and then afterwards they're back to sitting down normally again. So just keep this in mind when we're doing the fat transfer to the buttocks. I'll see you in a few minutes to answer all your questions.